So an estimated 1.3 million Americans are living in nursing facilities, and many of them have been left quite vulnerable during this pandemic. More than 10,000 nursing home residents and staff members have lost their lives to COVID-19, and families have been pleading for information to help. Well, here with vital advice for those loved ones in nursing homes is Elaine, AARP's Vice President of State Advocacy. Good morning. Thank you for joining us.
Good morning, Betty.
So we've been talking about the vulnerability, but give us an indication from your standpoint, how vulnerable are nursing homes during this crisis right now?
Well, nursing home really are an untold story, so thank you so much for bringing this to light. As you mentioned, over 10,000 Americans have lost their lives to COVID-19, and those Americans were living in nursing homes. And, you know, in New York, there are 104,000 New Yorkers who live in nursing homes. They are in a position, I think, where they're quite vulnerable to this because the pandemic spreads in those facilities. So we need to do all we can to provide the utmost staffing and protection for those residents and the staff who care for them.
Help us understand, because we have reported this many times, that it is spreading, just like you said, in nursing homes. But why is that? Is it that they're not prepared? Do they not have enough support to protect? What is going on inside those nursing homes?
Well, you know, I have to say that nursing homes were really not of focus nationally. Of course, you recall that the first nursing home outbreak was months ago in Washington state. But since that time, I think nursing homes fell out of focus. And what was happening is that, as you may know, nursing homes are not well staffed. They didn't get prioritization when it came to giving staff personal protective equipment. There isn't adequate testing going on in nursing homes. And as a result, I believe what has occurred across the country and certainly in New York is that more and more people have contracted the coronavirus and unfortunately have passed away from it.
So for those family members out there, and we've talked to many of them, they're just distraught because they can't go in and see their family members. They're relying on people to call them, to give them an update. Sometimes that doesn't come for days. How do you help families like that?
Well, my heart goes out to New Yorkers. You know, my mom and dad were both in nursing homes in New York, so I understand that pain of dislocation. And here are some tips that we're offering. You know, please be active. You are the best advocate for your friends, for your family, your loved ones in those facilities. Ask questions. Call and ask people, do you have any COVID-19 cases in your facility? What are you doing to stem the rate of infection? Do staff have personal protective equipment in order to care safely for my mom, my dad, my loved one? What can I do in terms of learning more on a daily basis of what's going on in your facility? And can you help me communicate directly with my loved one in that facility? Can you help facilitate a virtual? You know, people need that kind of support. So ask, and if you don't get answers, Betty, please call the New York State Ombudsman's Office. Now, that's a lot of words. Here's the address, nasop.org. If you go to that website...
I'm sure that's on your website. Elaine, I'm sorry, we're out of time. We appreciate your information. I'm sure that's on your website as well. We'll try to get it on ours, but crucial information for families trying to get information. Thank you for your time today.
Thanks so much.